Did you know that pancreatic cancer is one of the deadliest cancers in the world? The most frightening aspect is that it often grows silently, without showing noticeable symptoms in its early stages. By the time signs appear, it's often too late. The good news is that if you know how to recognize the warning signs, you can take action in time. In this video, we'll reveal 7 shocking signs of pancreatic cancer that you need to watch for. Some may surprise you, and others might make you rethink those small changes in your body that you might have ignored. Before we start, don't forget to like this video, subscribe to the channel, and share it with your family and friends. You might save a life today. Let's get started. Sign number 1. Unexplained weight loss. Losing weight effortlessly might seem like a dream, especially in a world filled with diets and gyms. But if the pounds are dropping fast and you're not doing anything to make it happen, it's time to be alert. Pancreatic cancer interferes with how your body digests food. The pancreas produces enzymes that help break down fats, proteins, and carbohydrates, allowing the body to absorb nutrients. When it doesn't function properly, digestion slows down, and the body can't get what it needs. This leads to sudden weight loss, even if you're eating normally. Perhaps you've noticed your clothes fitting more loosely, or that belt you haven't worn in years now fits again. Maybe people around you have commented, "Wow, you've lost weight." But you know you haven't changed anything in your diet or exercise routine. Instead of feeling proud, you might feel confused or even worried. Additionally, constant fatigue is common since your body isn't getting enough energy from food. Many people think it's just stress, but this fatigue doesn't improve with rest. If you're experiencing these symptoms, it's crucial to see a doctor. While weight loss can have various causes, like stress, thyroid issues, or even diabetes, it's important to rule out something more serious, such as pancreatic cancer. Sign number 2. Abdominal and back pain. A constant or nagging pain in the abdomen or back is something many people ignore, assuming it's due to poor posture, overwork, or even gas. However, when this pain persists, it may be a sign that something more serious is happening. Pancreatic cancer can cause pain because the tumor presses against nearby organs or nerves in the abdominal region. Often, this pain starts subtly, like a feeling of discomfort that you try to relieve by changing positions or taking common painkillers. Over time, however, the pain can spread to the back and become more intense, especially when lying down or after eating. Imagine feeling that constant, nagging pain that never seems to go away. It can make simple daily activities challenging, like sleeping, working, or even enjoying time with family. Some people describe this pain as deep and hard to pinpoint, but clearly disruptive to their quality of life. If you're dealing with this kind of pain that doesn't improve or keeps coming back despite rest and medication, it's essential to consult a doctor. This pain could have various causes, like spinal issues or gastritis, but it can also be one of the early signs of pancreatic cancer. Sign number 3. Yellowing skin. Jaundice. Another warning sign to watch for is when your skin or eyes start turning yellow. This can be a clear indication that something is wrong, and in the case of pancreatic cancer, it's often related to a blockage in the bile duct. The pancreas is located near the liver, and when a tumor blocks the flow of bile, a substance that helps digest fats, it accumulates in the body, causing the yellowing of the skin and eyes, known as jaundice. Often, this is one of the first noticeable signs of the disease. In addition to the change in skin color, you might notice other associated symptoms, such as intense itching, dark-colored urine, or even lighter-colored stools. These changes can be concerning, but many people dismiss them as minor issues, like an allergy or temporary liver problem. If you notice these changes in yourself or someone close to you, seek medical attention immediately. While jaundice can also be caused by conditions such as hepatitis or gallstones, it's not worth the risk of ignoring this sign. Sign number 4. Changes in digestion and stool. Have you noticed significant changes in your bowel habits in the case of pancreatic cancer? This can go unnoticed, but is an important warning sign. When the pancreas isn't functioning properly, it doesn't produce enough enzymes to aid in digesting food, particularly fats. This can result in noticeable changes in your stool. It may become lighter in color, greasy, or even float in the toilet bowl. Often, it's accompanied by a very strong and unpleasant smell, indicating that your body isn't absorbing nutrients properly. Additionally, issues like bloating, gas, and a constant feeling of indigestion may become part of your daily life. You might feel heavy after meals, even when eating light foods. These symptoms can easily be mistaken for conditions like food intolerance, irritable bowel syndrome, or gastritis, but it's essential not to overlook them, especially if they persist. If you've noticed persistent changes in your digestive and bowel habits that don't improve with dietary adjustments or medications, consult a doctor. Digestion is a powerful indicator of overall health, and prolonged changes should never be underestimated. Sign number 5. Loss of appetite and constant fatigue. Feeling less hungry than usual may not seem like a big deal, especially if you're busy or stressed. However, when this loss of appetite is accompanied by extreme fatigue, it may signal something more serious. In the case of pancreatic cancer, the body is dealing with an intense inflammatory process which can result in a constant lack of energy. This happens because the tumor drains the body's resources and interferes with digestion, leaving you too exhausted for even simple activities. Many people describe this as fatigue that doesn't go away, even after a good night's sleep. They may also begin skipping meals because they simply don't feel hungry or because eating becomes uncomfortable. Foods that once seemed delicious may lose their appeal entirely or even cause nausea. These symptoms can easily be mistaken for stress, overwork, or even depression. However, if they persist and are accompanied by other signs, such as weight loss or abdominal pain, it's time to seek medical advice. Sign number 6. Sudden and unexplained diabetes. Another often overlooked sign is the sudden onset of diabetes, especially in people with no family history or those who have always maintained normal blood sugar levels. This happens because the pancreas is responsible for producing insulin, the hormone that regulates glucose in the body. When cancer affects the pancreas, it can disrupt insulin production, causing blood sugar levels to spike or drop unexpectedly. You might notice symptoms like increased thirst, more frequent urination, or feeling exhausted after meals, even those that aren't particularly heavy. If you've been diagnosed with diabetes unexpectedly and are also experiencing other symptoms, such as weight loss or abdominal pain, it's crucial to discuss the possibility of something more serious with your doctor. Early detection can make all the difference. Sign number 7. Blood clots. One symptom that often confuses even specialists is the formation of blood clots, particularly in unusual locations like the legs or lungs. Symptoms may include swelling, redness, or pain in the affected area, or sudden shortness of breath if the clot travels to the lungs. In pancreatic cancer, inflammation caused by the tumor can alter the way blood clots, increasing the risk of thrombosis. This is a serious symptom that should never be ignored, as it can be life-threatening. If you've recently experienced blood clots or been diagnosed with thrombosis without an apparent cause, it's important to investigate further with a specialist. While clots can result from many conditions, they can also be one of the earliest signs of pancreatic cancer. Stay alert to the signs. Pancreatic cancer is deceptive, but with awareness and attention, you can act in time. If you've noticed any of the signs mentioned, such as persistent pain, digestive changes, or unexplained weight loss, seek medical advice immediately. Prevention and early diagnosis save lives. If you're interested in learning even more, don't miss our next video, Cancer Warning Signs You Should Never Ignore. We'll discuss silent symptoms of other types of cancer that can be fatal if not detected early. Stay informed and take care of your health.